I'm Dr. Robert Vitolo.
And I'm Lillian Glass. Thanks for joining us. Millions of women have had breast implants since the procedure was first developed in 1956. But a lot has changed since the early days, not only in terms of implant safety, but the way doctors are working to make the results look natural.
One of the biggest breakthroughs in achieving a natural look is the elimination of visible scarring through a technique called endoscopic breast enlargement. Today, it's the only way I perform breast implantation surgery, and my patients love the results.
Dr. Vitolo, what are some of the most common reasons that women request a breast implant surgery?
Well, Lillian, there are basically two reasons. One, the woman has not developed adequately and is unhappy with the size of her breasts, in which case we make them larger. Or there are women that have lost volume in their breasts from pregnancy, and this is a really major concern because pregnancy does wipe out a good portion of the breast tissue.
What about weight loss and gravity?
Weight loss and aging also contribute, to the loss of breast tissue.
Well, how do you perform this breast augmentation that's virtually undetectable?
Well, basically we use the body's one natural scar. Everyone is born with one scar, and that's the belly button. So what we do is we use a type of implant that's an inflatable implant. We make an incision all the way in the depths of the belly button. Now, since the belly button already is a scar, when my incision heals, it heals as a scar on a scar. And there's no new scar, and the color of the two scars blends basically imperceptible. Plus, it's all the way down the bottom of the belly button. So what we do is we take an implant like this that has a self-sealing valve in it. We put a plastic filler tube into this valve, and we remove all the air. The implant now becomes flat. We roll this implant up, with the tube inside of it, and we make an incision through the belly button. We tunnel up underneath the skin, just right underneath the skin, not inside the abdomen. We slide this up until it sits underneath the breast tissue. And then from outside the body, like the old ship-in-the-bottle technique, we inflate the implant. So now it becomes like that. Now what we do is we inflate the implant with a saline solution. So it has a natural feel. And saline is a natural body fluid. So it simply, if it should leak, the body absorbs it, and it's absolutely harmless to the body. Very simple. The patient's own natural breast sits on top of the implant. When it's the right size, we pull the filler tube out, and we do the other side. And it takes about 30 minutes, which is really amazing when you consider how much longer the other techniques take.
It does feel kind of natural,
With this technique, the breasts feel natural, soft, they move naturally.